My name is Mike Whitty. I'm medical director for Coastal Health Alliance, a small set of rural health centers on the Marin County coast, and also I'm proud board member of the CPCA board. And I'm really proud to present a colleague of mine and a friend as a hero of community health, Dr. Winston Wong. I take it that applause also means that you guys like me know Winston Wong, which if you actually Google Winston F. Wong, he comes up 10 times before anybody else does. Even Winston Wong, which is a very common name, is something, he's right there. And he's right there because he's just involved in so many different things, and they're all really things that we would be very proud of and are very proud of with respect to community health. Winston is a graduate of UC Berkeley and UC San Francisco School of Medicine, and now serves and has served for several years as the medical director of community benefits at Kaiser Permanente. In that role, he's been responsible for the organization's partnerships with communities and institutions in advancing population management and evidence-based medicine, with a particular emphasis on safety net providers and the elimination of health disparities. And I think that's actually part of his own personal mission, really, is to eliminate health disparities. In his role with Kaiser Community Benefits, he's helped financially support CPCA members, and I can include myself and certainly a lot of my colleagues, by supporting innovative projects among safety net organizations and developing and cultivating community partnerships that address the needs of the underserved and the pursuit of health equity. Throughout his career, Dr. Wong has proven many times over his commitment to bringing healthcare access to all. Prior to joining Kaiser, he served in various roles in Region 9 Office of the Department of Health and Human Services, and was in charge of clinical development of federally qualified health centers in a 4-state territory and the management of California programs supported by HRSA. He was an early advocate of the recognition of the social determinants of health, and I've heard him speak about this eloquently many times, as an essential factor in healthcare outcomes. In 2013, Dr. Wong was appointed to the Institute of Medicine's Board on Population Health and Public Health Practice, and as a founding member of the Western Clinicians Network, he was instrumental in developing the clinical library, which is now being administered by CPCA as an innovative point-of-service tool, especially designed for use by care providers at community health centers. He's also a board member of the California Endowment, the Essential Hospitals Institute, and the School-Based Health Alliance. This is all as of yesterday. By today, there's probably something else that he's a member of the board of. He is bilingual in Cantonese and Toisan dialects, and he also continues to practice family medicine at Asian Health Services in Oakland, volunteering at the health services and seeing patients on a regular basis. It's for this dedication and commitment that we recognize Dr. Wong as a CPCA hero. It's my honor and privilege to introduce my colleague and amazing advocate for community health, Dr. Winston F. Wong. Welcome.
Thank you. That's just beautiful. And I meant Mike's speech, not the award as much. But actually, how many people are here today? It looks like about 800, maybe 1,000, Carmela. It's a great show of support. And I wanted to use this opportunity in front of 800 people to thank some folks. Number one, I want to thank the San Francisco Giants for winning a couple of days ago, so that I could fully enjoy the Sheila E. concert tonight, because it would have been a distraction. But more importantly, Carmela reminded me how important this convening is in terms of 20 years of accomplishment by the California Primary Care Association. And many of you folks out there, I've had really the honor and pleasure of working with over the 2 decades of your existence. And when I think about the CPCA, I really can't think of a more consistent champion for the healthcare rights of Californians. So I really applaud you, Kaiser Permanente applauds you in standing up consistently for healthcare access and, dare say, healthcare justice for Californians. Now, I think Mike mentioned a few places that I've been in my career. My current home is Kaiser Permanente, and we do have some folks from the Kaiser Permanente team here. I just want to mention a few. Angela Carone from our Southern California region, Community Benefit, Sherry Novik, who also leads Community Benefit and Government Relations, and Jean Noodleman, also from Community Benefit for our Northern California region. They've been great supporters and colleagues throughout the work that I've been able to do at the national office. So thank you, KP team. There are a couple of things. I was just thinking, too, about my work at Asian Health Services and the folks that I've had an opportunity to really learn from. I don't know if Sherry Hiroto's in the audience, but we've come a long way, and I don't know how many of you can relate to me in terms of having a stack full of cardboard placards in front of your table with poster paint and waiting to put together the picket sign, the picket sign that we would use to march in Alameda County, in San Francisco, certainly in Sacramento, advocating for the rights of our patients and advocates for increased healthcare access. And my, oh my, how far you've gone in terms of from the picket line really towards advocating and defining the rules and the policies that are going to open up access for all Californians. This is a remarkable journey, and part of what I've been able to do is to join you in that journey. Now, Mike is part of the Western Clinicians Network, too, and I know there's some Western Clinicians Network members out there, and I relate to that group in terms of being a primary care physician. And I think it's so important for us as we think about our 20 years of work here at CPCA to continue to think about how much we learn from our patients every day. And they're really at the central feature of why we do this work. And also about what our responsibilities in terms of cultivating leadership, cultivating the new infusion of talent that's all around us. And I bumped into Harry Foster earlier this morning, who recently retired. But he and I thought about the importance of really thinking about how the young people and the people who are emerging from our universities and from the healthcare workforce itself, how critical they are in the future of community health centers and the California Primary Care Association. The other last point I wanted to make is how much we need to be deliberate in drawing from the wisdom of our communities. So it's not so much about what I've done or frankly what you've done, but what our communities do and how we become intentionally very engaged in their wisdom and in their power and trust in where they bring us. This is so important as we open up the doors that are afforded to us from the Affordable Care Act and Covered California. There's a lot more work to do in California because there are still people that face really barriers in terms of getting to the kind of care that you offer. And I think at Kaiser Permanente, we can't think of a more stalwart partner in all ways in developing a future where every Californian and every kid in California has the opportunity for optimal health and really to thrive. So thank you very much for honoring me.